For many expectant mothers and their partners, the question of whether sex is safe during pregnancy is common. The good news is that, in most low-risk pregnancies, sexual activity is perfectly safe and can even be beneficial for emotional intimacy. However, it's always wise to consult your healthcare provider first, as they can assess any individual risks based on your medical history or pregnancy complications. Certain conditions, such as placenta previa or a history of preterm labor, may require restrictions. Understanding the stages of pregnancy is also important. While sex is generally safe throughout, some women may experience discomfort in the later trimesters due to physical changes. Pay attention to warning signs like bleeding, severe pain, or cramping after intercourse, as these could indicate a need for medical attention. Open communication with your partner is key. Discussing comfort levels, desires, and any concerns helps maintain a healthy and satisfying intimate relationship. Emotional and physical comfort should always come first. Hormonal changes can affect libido, so it's normal for interest in sex to fluctuate. Mutual respect and patience ensure both partners feel supported. If anything feels off, don't hesitate to pause and seek professional advice. Safety and well-being are the top priorities. Too many myths suggest sex during pregnancy is risky, but most are unfounded. One common fear is that intercourse could harm the baby, but the fetus is well protected by the amniotic sac and uterine muscles, making physical injury unlikely. Another concern is that orgasms might trigger preterm labor, but unless a healthcare provider has advised otherwise, contractions from orgasms are usually harmless. Evidence shows that, for healthy pregnancies, sex doesn't increase miscarriage risks either. Some women worry about infections, but unless there's a specific medical concern, the body's natural defenses keep the uterus safe. Addressing these misconceptions with facts helps reduce unnecessary anxiety, allowing couples to enjoy intimacy without fear. If doubts persist, speaking with a doctor can provide personalized reassurance. Understanding the science behind these myths empowers expecting parents to make informed decisions, fostering a more relaxed and enjoyable experience during this special time. To ensure comfort during sex while pregnant, experimenting with different positions can help. As the pregnancy progresses, avoiding pressure on the abdomen becomes important. Side, lying or spooning positions are often more comfortable. Pillows can provide extra support for the belly or back, reducing strain. Hydration is another simple but often overlooked factor. Staying well hydrated helps prevent cramps or discomfort. Listening to your body is crucial. If something feels uncomfortable, adjusting or stopping is completely okay. Mutual consent and open communication with your partner ensure both of you are at ease. If pain, spotting, or unusual symptoms occur, it's best to pause and check with a healthcare provider. Prioritizing comfort and safety allows intimacy to remain a positive part of the pregnancy journey, strengthening the bond between partners during this transformative time. Many pregnant women experience anxiety about the safety of sex during pregnancy, fearing it might harm the baby or trigger early labor. These concerns, while understandable, are largely based on myths rather than medical evidence. Healthcare professionals emphasize that for low-risk pregnancies, sexual activity is generally safe and does not pose a threat to the developing fetus. The baby is well protected by the amniotic sac, uterine muscles, and a mucus plug that guards against infections. Intercourse does not physically reach or disturb the baby, as the cervix remains closed and acts as a barrier. Another common misconception is that orgasms can induce preterm labor. While orgasms cause uterine contractions, these are typically mild and temporary, unlike the strong, regular contractions of labor. Unless a healthcare provider has identified a high-risk condition, such as placenta previa or a history of premature birth, there is no need to avoid sex out of concern for early delivery. Open communication with a doctor can provide personalized reassurance and clarify any restrictions. Evidence-based guidance helps dispel unnecessary fears, allowing couples to maintain intimacy during pregnancy. Understanding the facts can reduce stress and promote a healthier, more enjoyable experience for both partners. Always consult a healthcare provider if unusual symptoms, like bleeding or severe pain, occur. This section aims to replace worry with confidence, offering clear, medical-backed answers to common questions. By debunking myths, it encourages informed decisions and fosters a positive approach to sexual health during pregnancy. Maintaining comfort and safety during sex while pregnant involves choosing positions that minimize pressure on the abdomen. Side-lying, spooning, or having the pregnant partner on top are often recommended, as they allow for better control and reduce strain. Pillows can provide additional support to align the body comfortably and reduce discomfort. Staying hydrated is important, as dehydration can lead to cramping or dizziness. Open communication with your partner is essential. Both parties should feel at ease and prioritize mutual enjoyment. Consent remains a priority, and either partner should feel comfortable pausing or stopping if anything feels off. If any discomfort, pain, or unusual symptoms like spotting occur, it's best to stop and consult a healthcare provider. Listening to your body and adapting to changing needs throughout pregnancy ensures a positive and safe experience. Simple adjustments can make intimacy enjoyable while keeping both the mother and baby's well-being in mind.